Okay, I think we got it. Hello, everyone. I'm just waiting to see if it's. There we go. It looks like we are live. And how do I. There we go. Welcome. Come on in this room on this beautiful, gorgeous Sunday. Welcome to Shelton Slay Sunday. Woo! So excited to talk with you, with all of you. It has been a very interesting weekend. Hopefully, you've been able to see a few virtual events that we have had. So, Friday, we did a seat at the table with the wonderful Terrell McKinney, who's running in LD11 for State Senate. Saturday, we participated in the NDP Black Caucus Senate Candidate Forum, which was fun. So I hope you all had a chance to view that as well. And today we are rounding it out with Shelton Slay Sunday. So there's a lot of information that I have been eagerly wanting to share and talk with you all specifically about the topics. If it looks like I'm having some technical difficulties, just know that I'm trying to work it out with my riser and where I can look to maintain eye level. And so hopefully everything comes together, and if we do have an issue, we'll push through it. So let's just take a minute and get grounded. How are you guys doing? This is, I think I've lost count of the weeks of us staying inside and trying to be safe. I hope that you had a chance to get outside yesterday, that you are creating some type of routine in your house to get to your level of normal. Just know that it's okay. Again, this is a pandemic, and we're finding out how to manage in this instance. And so please be good to yourself, be good to your family, support local businesses if you can. I know that we have 22 million who filed for unemployment, and that's a really, really big deal. So check on your friends, check on your family, check on your neighbors, just see how they're doing. We have this wonderful technology, so you can even order groceries and have them delivered to someone's home. So I hope that we are showing love like we do in Nebraska. So I hope you all are well. Okay. Today, some of the issues that I want to address is definitely COVID-19. So on the website, let's start with the bad. We have now 39,000 deaths in America, in the United States. 39,000. That's 39,000 families that are impacted. That's mothers, daughters, fathers, brothers. It's very difficult to see that number continue to rise. And I know that none of us expected we would lose the amount of people that we are losing. And so if your family has been impacted, please know that you are in my prayers, that I am definitely looking at policies to prevent this from happening in the future. And the healthcare workers, the grocery store workers, the essential employees, everyone that is going into work, behind the scenes, even the supply chain individuals, all of you who are making sure that we have our food, that our loved ones are healthy, that anybody who has already difficult medical disabilities, then you're maintaining that, or you're working in shelters and helping the individuals there. I just want to say that we see you, we thank you for keeping this country running, keeping our economy running. If it were not for you, we'd be in a much worse space and predicament, so thank you. So please say a prayer for those 39,000 families, because I could not imagine, none of us expected this. Okay, that was the heavy. Let's get into progress and trying to move forward. So a few weeks ago, I explained, we did a Shelton Slay Sunday, and I gave you guys information on what I would do if I was in the legislature. I presented a COVID-19 plan, and I put it on the website. Well, I'm happy to see that some information that I've recommended in that plan is actually being recommended in the House of Representatives as we speak. So 2 days ago, Representative Tim Ryan, now Tim Ryan is a Democrat from Ohio. He's a very passionate individual. I like to watch him when he speaks because I find many, many similarities. And right now, he co-sponsored the Emergency Money for the People Act. What is that? Well, it's a bill that they are proposing, and it's going to, in the bill, it's recommended to give $2,000 to Americans over the age of 16 for up to 12 months. And so what they are saying is, if you can drive a car, you can get $2,000. Now that part, I don't know if that's going to make it through the Senate. It would be wonderful if it did. I suspect there will be some heavy debate over the age requirement, but I love the way that they are thinking. So the other thing that it does is, so what the CARES Act, and that was this, I guess you can call it coronavirus stimulus plan phase 1. This would be like phase 2. The CARES Act was largely centered around corporations and bailing out corporations. And it had a flaw. It did not ensure that college students and adults with disabilities can still receive their payments if they're claimed as a dependent. So this does that. So if you have a disability, if you are a college student and you are receiving aid, you are still able to receive that even if you are claimed as a dependent, so your parents or someone is claiming you. Now, additionally, it recognizes that not everyone has a bank account. This is brilliant. We are all exploring technology, right? And if you look at some rural areas, I worked in Winnebago. Not everybody in Winnebago, Nebraska has a bank account. And so, or a home address that you can technically send a check to. So in this Emergency Money for the People Act, it allows individuals to get money through direct deposit, check, prepaid debit card, or mobile money platforms, y'all, like Venmo or PayPal. That is amazing. So I'll be watching this. I hope you will be watching this to see what happens when it gets to the Senate and if there will be any adjustments. Just to be clear, what this Emergency Money for People Act, I want to talk about the eligibility because I did go over that kind of quickly. And so it's slated for 16 years of age and older. If you are making less than $130,000 annually, you would receive at least $2,000 per month. For married couples, if you are earning less than $260,000 annually, you would receive at least $4,000 per month. And then qualifying families, if they have children, they receive an additional $500 per child, and then families will receive funds for up to three children. So that's exciting. In Nebraska, we are not yet mandated to track the demographic information of all of these cases. I see, hi Craig, he said that in Nebraska, we have 1,287 cases and 28 deaths. I don't know if you guys watched Governor Cuomo this morning, but they are saying that they are on the other side of their peak, that their curve rose and it plateaued out, and then they're starting to see it decrease, and they are hoping that it's going to decrease. What does that mean for us? That it's coming in our direction. So although there are some businesses that are opening, Nebraska Crossing, please be safe. Please follow your instincts. Please make sure that you and your family are safe. We already have essential workers that are going out here risking their lives daily for us to make sure that we can be healthy. So please make sure that you're taking care of them as well. So I want to jump over to voting. And so please make sure that you guys are voting by mail. You should have by now received the green. I've showed it a few times, and I can grab it, or my assistant can bring it to me. Husband, you're my assistant. He can bring it to me and I will show you all. But if you have not received it, you can call your election commission. You can go to the Nebraska Democratic Party's page and still request the form to vote by mail. And so it looks like this. This is the card that you complete. You would sign the bottom. It's very, very simple. And you do not have to mail this back. You can scan it and email it. You can take a picture and email it. You can drop it off at the election commission. And so you have some options to do, but make sure that you all are getting a ballot. If you still need to register, you have until, I have to verify the date. I believe it's like the 24th. And so I shared that somewhere on one of my platforms or areas. So just make sure that you are doing that. And you do have to register to vote when you move as well. So you have until April 27th at midnight to register to vote. And there is a link on my website where you can select that. Okay. If you guys have any questions, drop it in the box. I'll make sure that I address it. So let's talk about our rural communities. Our rural communities are heavily affected by COVID-19 right now. We are having major issues. Why are they heavily affected? Because our infrastructure doesn't support COVID-19 testing. It doesn't support isolation. We just don't have, we're not set up. We have nothing set up out in our rural communities to help these families. Like I said this before, I'm still waiting for 2 or 3 weeks ago when our president stated that we would have testing in Target parking lot. We'd have testing in Walmart's parking lot, and you could do drive-up testing all throughout the states. We still are not seeing that. So we do not every single city in Nebraska does not have a hospital. Every single city in Nebraska does not have a clinic or an urgent care system. This is a huge issue. We were not prepared for a pandemic of this magnitude. Our infrastructure doesn't support it. And so this is an issue that we already knew, and what this pandemic has done is it's exposed the cracks, and we need to make sure that we have plans to fill in these cracks, guys. So in rural communities, we need hospitals. We need facilities that are in, I don't know what the specific radius would be, but I am in support of doing research to make sure that every individual in a rural town is able to get the care that they deserve and that they do not have to wait for it. So working in Winnebago, Nebraska, I saw many services that I totally took for granted in Omaha that I have easily access to in Omaha. If I need to see a GI doctor in Omaha, I can go to my PCP or my primary care physician. He can make a referral, and I'll see that doctor in probably a week or two. It's not the same in rural communities. And so we can't leave people behind. That's not who we are as Nebraskans. That's not who we are as Americans. And so I would support legislation to beef up our infrastructure in that area, not only on the medical side, but on the mental side. And so, again, this might be a repeat for some who have been following me, but I have shared that in working in Winnebago, Nebraska, we were very limited in finding facilities for adolescents who were having thoughts of harming themselves. And if somebody walks in and they are deemed as suicidal, it's a very small window of time that you're trying to get them help and resources. And so I know of about 4 places, and that's simply not enough. If it was your child, you would want them to help support right away. The other thing is, I wish that we would be forward thinking in the effect of food and our farmers and ranchers and everything that is happening, even in the restaurants. And so restaurants that have a surplus and farmers and ranchers that have produce stored, wouldn't it be amazing if we could partner with restaurants across our state and they could feed the essential workers? And then the essential workers wouldn't have to try to leave and take off their face mask and go through all the steps that they have to go through to try to be safe. And I know that many people have been supporting food deliveries, but why not try to save where we can? So this is back to what I recommended initially with this whole COVID-19 pandemic, is we need an emergency crisis team on the federal level that is helping us navigate how we can do this better. The other thing is we have to talk about our agriculture here and how many farmers in the state of Nebraska are filing bankruptcy. We are losing our small farms. So we have essentially given, like Costco and their chicken farms a leg up while we are pushing our family farms down. That should not be happening. Same thing with small businesses. Our local businesses are threatened in this manner. And so I know that this emergency people, I'm going to mess up the words, Emergency Money for the People Act is looking at the people. And so I'm waiting to see what information they have regarding small businesses. And I hope that it gives money federally to all of the governors so that we have the funds to implement the plans that we need to implement at this crucial time. So I support Amy Klobuchar's plan for rural areas. She has really great details. I don't know where I'm at in my time. Okay, I just did a time check. So I will post the points of rural because it's not just about COVID-19. It's not just about farming. I do support regenerative farming. It's not just about, sharing the food. There's so many details to this. So I'll post it on my page so that you guys have time to review it, and then you can ask questions on why I support it. The other thing that I want to address is our presidential race. So the one thing I really love about our democracy is the right to choose and the freedom of choice and our free will. And in our presidential race, we had so many amazing candidates, you guys. I got to see and hear ideas that I've never, ever, ever heard presented ever on a presidential platform. It's very exciting that we have individuals who are willing to take a step up and say, hey, this is what we need right now. And so in this moment, I think that the best way for us to move forward is to unite. And while I like plans of all the candidates that have been here on the platform, I am moving forward and endorsing. Sorry, I feel like somebody is this a message that I need to say right now? No, I don't think it is. Okay. I am moving forward today and endorsing Joe Biden. Now, if you look at Joe Biden's commitment to real people and his experience, it's easy to support him. The many hardships that he has faced throughout his life, meaning like the deaths that he has experienced, oh my gosh, it reminds us that he is human and that he will fight for us because ultimately, guys, he knows us. So the best way for us to move forward is to ensure that those plans that we heard that were amazing, that we present them and say, hey, will you take this on? What have you thought about this? Because this is what we need right now. But in our party, we are so colorful and so diverse in this most recent platform that I hope and I believe that he will honestly listen to the past candidates and list the past presidential candidates. And I think that he will move in the direction where all those who have endorsed him, Bernie Sanders, Elizabeth Warren, where they are encouraging him to go. And so that is official today. Alicia Shelton is endorsing Joe Biden. Now, on the therapist side, I know that there have been some talks about some inappropriate touching, and I'm not trying to push anybody's stories down. I think all candidates know that when you step up, everybody is going to be looking at your past. And if there is someone who has a story to tell your story. That is important. We should all always feel empowered to share and tell our truths. Even in my race, I hope all the candidates in my race look at that and say, hey, I know that's something that if there's something in my past, it's going to come out, and it should come out because people need to feel safe. They need to feel secure in their choice. And so while I support your choice, I am moving forward and trying to unite our party. I think it's time for us to stand together. We need that movement of love. We need to make sure that going forward, we will never, ever be in the position we are today at this very moment in our country. So I hope you guys will consider joining me, and I hope that you will consider voting for me. The difference, I've also had many people asking me what makes me stand out from the other candidates. And so I will just make sure that it's clear. My experience, that makes me stand out. My experience and my determination. So I have gone to Washington, D.C. with my sorority, Delta Sigma Theta. I have sat in workshops for 3 to 4 days and then gone on the last day to speak with my legislator. I have been prepared. I know how to do an agenda. I know how to create talking points. I know how to drive the conversation, and I know how to organize and get people together. And so I'm familiar with Senate proceedings. I'm an expert on Robert Rules of Order. I can run a meeting like nobody's business. And that is what makes me stand out from other people. The other part is, in my experience, I know how to build rapport. I know how to listen. I've never, ever met a political candidate or as anyone in office, an elected official that has really, truly listened to me. There are a few that come close, and the state legislator that are wonderful. But on a federal level, I have never, ever seen that. That's what I bring to the table for you. So any questions that you have, it's I got like about 5 minutes. I don't remember what time we got on here, so maybe I've got a little bit more. Maybe I've got about 6 minutes. Please, please, please put your questions in the chat, and I will address them at this time. I hope, again, that you are doing well. This will stay on my page so you can come back and review it. But I am very excited to move our party forward. I'm very excited that some of the recommendations that I said on COVID-19 is currently being presented in the House of Representatives. And I'm very excited to say that it's time for us to move forward, unite the party, and I'm very excited to endorse Joe Biden. So moving forward, I hope you will join me. And if there's anything that I can do to help you, please let me know. And I'm ready for your questions. Okay. Hi, guys. Hi, Jordan. Hi, Ariel. Hi, Craig. Babe, am I missing any questions? Are you tracking for me?
No questions.
Okay. No questions. I know you guys have seen my face all weekend, and so you may have already asked some questions. I'm trying to think if there's anything that I did not get to say or identify in any of the previous areas.
Got one.
Okay.
What techniques will you use to reach across and work with Republicans?
Ooh, this is a good one. So I have been trained as a mediator, and I have testified in my career and in my experience. And so the very first thing, I'm really good at compromising. I'm very good at negotiation, and there's a difference. I am so great at negotiations that my family members have reached out to me anytime they buy a car, or if they're asking questions about, taking job deals. And if they're on here, they can comment that that's how great I am. And so the techniques that I would utilize would generate from that. And the very first skill is to listen. You have to listen to people, because if you actively listen, they will tell you what they want. Once you determine what it is that they want, you simply make a plan to reach it, and together. And so you have to, and when you listen to what people talk or how people talk, they typically tell you what their non-negotiables are when they are talking. And so I would use those techniques, all that training that I got in mediation. I'd use that to negotiate and to compromise and work across the aisles. And I know that I'd be successful at it because I already do it. I do it now. I do it with insurance companies. I do it with my clients. I do it when I'm presenting policies at the hospital level and stating why we need these policies. I do it when I'm representing clients that I see. So it's something that I have great experience with, and that's one skill that I'm honored and happy to bring to the table for you all. And I've said this before, I am looking for a team that is comprised of what Nebraska looks like. Everybody should be represented, whether that's various gender backgrounds, various colors of the rainbow, whoever. I want you all on my team, because this is historical. We have never even had the opportunity to put a person of color in this position for United States Senate. But don't vote for me because of the color of my skin. Vote for me because what I bring to the table. Because I have a blueprint that is reminiscent of Shirley Chisholm and my previous sorority sisters, because you know my work, because you can see it, because I have been consistent. Those are the reasons that you should. Another question?
Another question. What will you do first for the Black community in regards to the healthcare disadvantages that your opponents will not?
So I don't know. I can't speak for my opponents because I'm not them. And so I can tell you what I would do. And the very first thing that I would do is, I've talked about implicit bias and training, and I'm not sure that everybody 100% of the way knows what that means. This is basically an unconscious bias, implicit bias training. And what it does is it makes you aware. It exposes your prejudices. All of us, we have preferences. And whether you're ready to believe that or not, we all have preferences. I don't eat beef. That's a preference. I don't eat pork. I've never had pork. I hate the smell of bacon. I know some of you guys love bacon. I hate the smell of bacon. I would prefer to be in a bacon-free environment. That's a preference. Get out of here, husband. So we all have ideas and we all have preferences. And so if you have a preference, then you may have a small prejudice that you may not realize is there. It exposes that. So with healthcare, we currently do not have a facility in our United States that has unbiased healthcare. We have people who have biases. And I've worked in hospitals, and I'm talking about from the level of the phlebotomist, the person who draws your blood, on up to the nurses, to the doctors. We all have small level of biases for whatever reason that we have them. And so the best way for us to expose them is to take the training and work with them. So I believe that every hospital, every clinic, every person who works there should have an onboarding process where they take implicit bias training, number one. Number two, we need an education for all patients. Every time you see your doctor, you sign for an updated HIPAA every year. You sign to update your phone number, your information, and to say, hey, you guys can go ahead and leave messages for me, right? You sign and update that. But you never get something that says, hey, if you do not like this doctor, if you are struggling, these are your rights as a patient. You can request X, Y, and Z. We don't get that information. There needs to be more patient education surrounded around your experience. And that if, hey, it's okay, if you don't like something, here's our complaint process, or you can request another physician. So I think that there needs to be a level of transparency there. And you what?
Oh, sorry. But also Abby said teachers needed too, bias training, that is.
Oh, yeah. You made me forget. What was the hospital question?
Sorry about that.
Oh my gosh, you guys. Okay, sorry. What will you do first for the Black community in regards to the healthcare disadvantages? Okay, so I think that implicit bias training for onboarding for all workers, patient education on how the rights that you have as a patient, that is key. And I think moving forward, hospitals can form their policies around that, but moving forward, I think that's where we need to start. Now, I know that Elizabeth Warren talked about giving, it wasn't a stipend, but, basically federal dollars to hospitals who were able to reduce these advantages. I totally think that that's great. I haven't worked out the details on that yet. But I think that those two are the first two things that I would do in empowering the people to make sure that they understand what their rights are, and mandating that all hospital workers have this for onboarding. Yeah.
We are seeing a rise in hate crimes against minorities of color, including Asians, LGBT, etc. What legislation will you introduce to help bring down those crimes?
Ooh, that's a hard one. And I'm going to tell you why that's a hard one. So it's easy to say, and I would do this, make sure that we have legislation that maybe puts a heftier weight on hate crimes. But it took us 100 years to make lynching a crime. It was first introduced in 1919. It was finally passed in 2019, guys. So think about that. We have seen, as a mental health therapist, when Trump became president, when the Joker movie came out, I have had people come in to speak about the experience that they have had that they've never had in our state, of racism, of discrimination. And so this is an issue. The best way for us to do this is to encourage everyone recognizes their exposed their limitations. Again, implicit bias training is this. If I could mandate this for everyone, I absolutely would, because I've taken it and it's eye-opening. But we have to start with given the level of, this is what you will get for this crime. Kind of like how you get more time for crack than you do for cocaine. Come on, somebody. Like that, in that manner. And then the other thing that we need to do is we need to make sure that as much as possible, anywhere it's possible, that we diversify. Everywhere, in the school system, in the hospitals, in the clinics, in your Democratic Party, and your whatever you are. If you're a Republican, in the Republican Party, everywhere as much as possible, we need to be inclusive. Why? Because that's the best way for us to see each other, for us to understand the needs of the human race, because we are all part of the human race, and how we can work together and move forward. I don't know what you're experiencing if I don't talk to someone who is Asian American. I can see what's in the news, but I really don't know what it's like until I have a conversation with you. We all need to be at the table, and we have to move forward, and we need to empower these individuals. It's not just creating a talking circle and saying, hey, what's your problems? It's putting them in positions of power. What are positions of power? Positions where you pay them a reasonable, livable wage. That's what we need to move this country forward. That's what I want on my staff. I want paid people in Washington, D.C. with me from this state that are going to always highlight the issues that are happening back at home. So I know that I started a little bit late, so I'm hoping to stay within that 30-minute window, but what other questions do we have?
Well, there was no other question, but Abby made a statement about, I'm a farmer, not in your district, but I certainly feel you in about what farmers need if you're interested. And I just replied back to Abby, appreciate the info, Abby, but Alicia's running for the entire United States Senate, so you are in our district. So please spread the word. Team Shelton here.
Hold on. Okay, so in the state of Nebraska, if you are in the state of Nebraska, Abby, I am in your district. Because I am running for United States Senate across the state of Nebraska. And while I do support Amy Klobuchar's plan, I definitely would love to talk with you. As a researcher, I've said this before, as a therapist, I look at research. The best way for me to compile data and to understand how many people these policies will help is to talk to as many people as possible. And so I have talked to some farmers, and I am very interested in talking with you to hear what more information you have, and just your story. Your story is a jewel to me. We all have jewels. That's what motivates us. Our stories motivate us and inspire us to be better. I am inspired to be better, to work harder for you, to bring something to Washington that we have not yet seen. Again, I am running against Ben Sasse. He voted against the coronavirus plan, the stimulus plan. He was one of the 8. Why? Because he's not in touch with us. And that's the bottom line. If you think $600 in addition to, what's the maximum? I think like $500. So if you think that that is enough, so let's say unemployment, you receive $1,100, which it would not be because taxes has to come out of that. So I don't know what it would be. Maybe $900 if you receive $900 a week. Is that enough for your family to live? No. You're still paying mortgages. Not everybody's mortgage has been waived. You're still paying car notes. You're still paying credit cards with 22% APR right now. It's not decreased. We still have a life to live. So I hope that you will be watching, because I will be watching what the Senate does with this bill that we've discussed. And I am ready. I have yard signs. I am ready to talk with you. I'm very laid back. and I hope you find me to be relatable because I am open to as many conversations as possible.
Well, no more questions. But
okay.
We just had a comment here.
What's the comment?
Ben and Deb only come around during election time, and I'll make a comment. If it wasn't for COVID-19, we would be out there.
Yeah. Oh, yeah. We had a big plan, guys, to tour our state. I was excited about it because I've heard many people were like, that has not been done. Are you sure you want to do that? We were going to kick off a tour in the mid-March and beginning April, and we can't do it. And so we have so many yard signs because we anticipated this tour. And so that's one reason. But Craig, Ben, and Deb have not even been in North Omaha. So they've not been in every rural town. Now, here's the thing. I know that we have many, many cities in Nebraska. But as a United States Senator, it should be your duty to try to hit as many cities as possible. And if you can't, we have technology. We are doing right now virtual town halls. We can do a virtual town hall with the city and hear their concerns. I believe if you're an elected official, I should see you. You should not be untouchable. I went to Washington and still didn't see Ben Sass. So I hope you all are well. Any questions you have, please reach out to me. Talk with me. I'm here to help you. Any issues you think I'm not speaking on, I'm ready to highlight. Check out my website. We have included more stances on the website. We also have an online store if you'd be interested in a t-shirt or a cap. Also this weekend, we are doing our threes because we are getting to 3 full weeks of the campaign remaining until the primary. And so feel free to donate $3, $30, $300, whatever you want to donate in the threes, we will take it. And we are very excited to move forward. So I leave you with, I am very, very honored to even be in this position. I am excited. I am here for you, and I am ready to go to DC and bring love back to the table and negotiate and work together to make this a better America. So thank you all, and I will talk with you soon. Bye-bye.